Hello everyone, it's Charlton. Please subscribe to my channel. Tap the notification bell. I would appreciate it majorly. And the latest on the hydroxychloroquine, endless. It's not a debate. I mean, it just is staying in the news. Trump keeps it in the news. And then there's a couple new studies out there too that basically dispute, the previous studies. And it's a small study, but I don't know. I just put more weight in it because it seems to get at the heart of the matter. That for people who are very sick, it's not helping, and it's a very small study. The latest is that Dr. Fauci and Peter Navarro got in some heated exchange yesterday during meetings while they were working before the press conference yesterday, the 2-hour press conference that they're now giving every day. There wasn't even supposed to be one today, and they last minute abruptly did have one. Came up again, actually. Fauci was asked about it, and he wasn't allowed to answer. Trump basically interjected and said he's been asked that 15 times and brushed it aside and basically forced the press conference to move on. I'll play that if I can, and I'll play what Trump said about it yesterday. But this was before yesterday's press conference. So apparently, it says that toward the end of the meeting, Hahn, who's the FDA director, I believe, Hahn began a discussion of the malaria drug hydroxychloroquine, which Trump believes could be a game changer against the coronavirus. Hahn gave an update about the drug and what he was seeing in different trials and real-world results. Then Navarro got up. He brought over a stack of folders and dropped them on the table. People started passing them around, and the first words out of his mouth are that the studies that he's seen, I believe they're mostly overseas, show clear therapeutic efficacy, said a source familiar with the conversation. Those are the exact words out of his mouth. Clear therapeutic efficacy, which means it works. Navarro's comments set off a heated exchange about how the Trump administration and the president ought to talk about the malaria drug, which Fauci and other public health officials stress is unproven to combat COVID-19. Fauci pushed back against Navarro, saying that there was only anecdotal evidence that hydroxychloroquine works against the coronavirus. Researchers have said studies out of France and China are inadequate because they did not include control groups. There's other reasons they're inadequate, definitely, beyond just the fact that they didn't include control groups. And I'll point them out to you quickly after this. Fauci and others have said much more data is needed to prove that hydroxychloroquine is effective against the coronavirus. As part of his role, Navarro has been trying to source hydroxychloroquine from around the world. He's also been trying to ensure that there are enough domestic production capabilities inside the U.S. Fauci's mention of anecdotal evidence just set Peter off, said one of the sources. Navarro pointed to the pile of folders on the desk, which included printouts of studies of hydroxychloroquine from around the world. Navarro said to Fauci, "That's science, not anecdote," said another of the sources. Navarro started raising his voice and at one point accused Fauci of objecting to Trump's travel restrictions, saying, "You're the one who early on objected to the travel restrictions with China, saying that travel restrictions don't work." Navarro was one of the earliest to push the China travel ban. That's not true, though. And I think Fauci basically, it goes on to say, and I'll read it in 2 seconds here, that Fauci was confused. I mean, this was a setup. It was. It's trying to basically, and they want this to get reported on. They're trying to slowly minimize Fauci, and it can work. I mean, Trump is just masterful at just tearing people down. Fauci looked confused. According to a source in the room, after Trump imposed the travel restrictions, Fauci had publicly praised the president's restrictions on travel from China. Pence was trying to moderate the heated discussion. It was pretty clear that everyone was just trying to get Peter to sit down and stop being so confrontational. Even Jared Kushner came to his defense. Eventually, Kushner turned to Navarro and said, "Peter, just take yes for an answer," because most everyone agreed by that time it was important to surge the supply of the drug to the hot zones. Hydroxychloroquine. Which basically, I mean, I do think that you have governors, even heads of hospitals, who are basically taking this on, okay, and ordering these things, all right. And yes, they want to try them, but my gut tells me that these governors are basically saying they're trying it just to placate Trump, so that because they need other things from him, they need ventilators, they need masks, they need the federal government's assistance, and they're in no position to basically to piss him off, And so this is one of the things that's required. I do believe that big time, big time. So because when you listen to every person who's basically on the front lines, in major hospitals, I don't know, you just get the overall impression that it's not a solution, man, and it's a harsh reality. So there's a new study out there, real quickly. Before I even do that, let me play Trump. Not letting Fauci answer that question. It wasn't that significant, but I'll play it for you just because you might want to see it. And then you know what? Right after that, before I plug in my earphones, I'll play what Trump said yesterday about hydroxychloroquine. Right after this supposed heated exchange between Navarro and Fauci.
Fantastic progress. And would you also weigh in on this issue of hydroxychloroquine? What do you think about this, and what is the medical evidence? That question? Yeah. Well, I maybe 15 times. You don't have to ask. He's your medical expert, correct? He's answered that question 15 times. Dr. Fauci. Fantastic progress. And would you also weigh in on this issue of hydroxychloroquine?
So here's yesterday's press conference. Trump talking about hydroxychloroquine.
And I hope they use the hydroxychloroquine, and they can also do it with Z-Pak, subject to your doctor's approval and all of that. But I hope they use it because I'll tell you what do you have to lose? In some cases, they're in bad shape. What do you have to lose? It's been out there for a long time, and I hope they use it. And they're going to look at with doctors, work with doctors, get what you have to get. But we have it stockpiled, and we have a lot of it. And we're getting more of it. And as I told you, I spoke to Prime Minister Modi. We're getting more of it, but we have a lot of it. And I hope they use it because it's been used for a long time, and therefore it's passed the safety test. FDA has been terrific. Dr. Hahn, I appreciate it very much too. But I've seen some results. Now it's early, I guess. It's early, but they should look at the lupus thing. I don't know what it says, but there's a rumor out there that because it takes care of lupus very effectively, as I understand it. It's a drug that's used for lupus. So there's a study out there that says people that have lupus haven't been catching this virus. No, maybe it's true, maybe it's not. Why don't you investigate that? And there's also other studies, with the malaria, that the malaria countries have.
I don't know. You can watch the rest of it if you want. I'll link it down in the description, I'm sure. And so this article is circulated at a number of different outlets. Several places have just basically republished the same article from The Conversation, and it's by Catherine Seeley Radka. She's a medicinal chemist who's worked on antiviral drugs for 30 years. She tells you this right here. And she's been working on coronaviruses for the last 7 years. And she basically was concerned that there's been too much, it says, I'm among a number of researchers who are concerned that this drug has been given too much of a high priority before there is enough evidence to show it is indeed effective. And then she goes on to basically briefly talk about the 2 Chinese studies that are out there, the 2 French studies that are out there, and that they're all small. And then she also points to another recent study that is also very small as well. But it disputes some of the same findings from the French studies and the Chinese studies. More the French studies. The French studies, she basically indicates, at least the second one. I don't know if Didier Rault was involved in this second one with 80 patients. I believe he was, because it's from Martial, or I'm not pronouncing that right. Maybe not. I know that his Didier Rault was part of the institute in Martial. Anyways, but she goes on to say that this French study with 80 patients, it's basically a lot of people that weren't really, they had very mild symptoms. In fact, she says, although some of the results appear to be encouraging, it should be noted that most of their patients had only mild symptoms. Furthermore, 85% of the patients didn't even have a fever. One of the major telltale symptoms of the virus, thus suggesting that the patients likely would have naturally cleared the virus without any intervention, that they might have just got better on their own, which is what I think is happening in a lot of these stories about hydroxychloroquine. Even a couple of the more extreme cases that have made the news. I saw the guy that was in the coma, and who, among other things, he was given hydroxychloroquine, and he and his wife were reluctant to put too much weight on the hydroxychloroquine, even though, believe me, a couple of the outlets, it's always the New York Post, or and other ones too, that seem to be friendly to Trump, that promote that publish these stories, so. But this French study basically was largely a lot of people that weren't even showing symptoms, and so she goes on to talk about another study that did, and then there's the very first study that got this whole thing started, which was Didier Rault, and it was 26 patients, and 6 out of the 26 were removed from the study, and 6 out of the 26 were the worst ones. They were the ones who were the sickest. They're the ones, like, three out of those 6 went on to the ICU. 1 out of the 6 died. Can't remember what happened to the other 2, but it just shows. I mean, that's not a good study where you take the people that that get sicker and that are the sickest and get sicker and don't get better from it, and you take them and you remove them out of the study for whatever reason, because they moved on to the ICU, so they were out of your domain, and you couldn't continue to test them or whatever. It's absurd. So, but she goes on to talk about another small study in a hospital in France, in St. Louis, France, or something, with 11 patients, which isn't a lot, but they were sick patients, very sick. And at the time of the treatment, 10 of the 11 had fever and had received nasal oxygen therapy. Within 5 days, 1 patient died, 2 were transferred to the ICU. In 1 patient, hydroxychloroquine and azithromycin were discontinued after 4 days because of prolongation of the QT interval from 405 ms before treatment to 460 and 470 ms under the combination. Mean through blood concentration of hydroxychloroquine was 678 ng/ml at days 3 through 7 after treatment initiation. Repeated nasal pharyngeal swabs in 10 patients, not done in the patient who died, using a qualitative PCR assay. They were, were still positive for SARS-CoV-2 RNA in 8 out of 10 patients. So 8 out of 10 patients didn't get better at days 5 and 6 after treatment initiation. I mangled that reading, but the point is when you tested very sick patients, 8 out of the 10 patients didn't get better, and 1 died, and people do get better. So the people who do get better, they're not necessarily getting better because of the hydroxychloroquine. Even the guy in the coma with the twins in Connecticut, his wife, who was a nurse and who was following his thing, it was such a strange sequence of events. And I chose not to make a video about it because I just did. But it was that same NBC reporter. They were on the Today Show, and there was that same NBC reporter that got in a heated exchange with Trump. I forget his name. And over hydroxychloroquine, not specifically named. He didn't name the drug, but giving the public false hope. I think he did name hydroxychloroquine, and that was before this couple was on the Today Show with him and another co-host, or he was co-hosting, whatever. And then a week later or so, the story comes out that he was given hydroxychloroquine, at a certain interval. But his wife said she didn't put a ton of stock necessarily in that. She kind of thought it was just from the overall care he was getting at the hospital, of ventilation, etc. Even he was in an induced coma. He was really sick. Anyways, listen, Well, the next few weeks are going to be terrible. And I suspect Bill Gates is right. The death tolls are going to be much lower than 100 to 240,000. I think Trump and Trump figured out early on, I'm going to highball this as high as I can, and when they come in with death tolls in the 50 to 60,000 range, he's going to call that a success, because we didn't reach 100 and 240,000 like, they had originally predicted, himself. But I don't think hydroxychloroquine will have any impact whatsoever on, on the success of this at all. And I think it's all just, smoke and mirrors, dude. Totally. And it's a shame. But, November will be here and everyone will get to make a choice. And the economy is, believe me, and people want to believe otherwise, but you can bet it is not going to get better for some time. It's just math, whatever it is. Even just going by the numbers that have been out there so far with 6 million claims and 3 million claims, that's 10 million jobs right there. 10 million. Okay. We normally add 200,000 to 400,000 in great times, a month. Okay. That means, so over the course of 5 months, you're going to add maybe 1 million jobs, and that means, multiply that times 10. That's 50 months. That's 4 years. And that's just for 2 weeks of jobless claims. And obviously, those numbers could come back in much bigger chunks initially, instead of 400,000 jobs added in a given monthly job report, it could be 1 million. But I'm just illustrating that just for 2 weeks of monthly jobless claims, and they're going to continue. All the economists agree that we're looking at, 15 to 20 to 25 million or more jobs lost. To bring those back in clips of 2 to 3 to 400,000 jobs per month is going to take a long time. And that's the story there, dude. So November will be here and everyone will get to choose for themselves. Thanks for watching my videos. Please subscribe to my channel. Give me a like down below. And I will see you in the next video. Later, man.